how important is it to satisfy the patient attending along with the patient? Dr. Shreyas Ramamurthy, in continuation with your thoughts, your opinion for the same?
I think it's extremely important. Often it's probably more important than the patient because patient itself, themselves, primarily because the decision maker for the procedure or the surgery quite often is not the patient but the patient's attendant. And it's important that we give equal chair time and importance to both of them. And at least for patients who do require a serious procedure, it's important that we allow the other attendants who might be just waiting outside the hospital to also come in, talk to them and explain everything which you would to the patient equally to them as well. I think that will go a long way in helping them choose a particular procedure and the right procedure for them.
Dr. Rishi Swarup, are you of the same opinion?
Yes, absolutely. And I think especially in our field, the attender becomes more important because many of the patients who are coming into our clinic can't see very well. So if you're trying to show them some visual aids or show them something, say an OCT, that this is the reason I need you to do this. So you often have to explain it to the attender, who will then go back and explain it slowly at home to the patient and convince them. Yeah. And often you have patients are very old. They are very rigid about their thoughts sometimes. So their children are a little more open to, say, a surgical intervention. So you can explain to them and then you can ask them to work on their parents later at home. So yeah, I think attender is very, very important. And I'm sure everyone will agree with me and Shreyas.
Dr. Grover, your thoughts?
I think Dr. Himanshu Mehta hit the nail on the head when he said that you can very easily, in 30 seconds with the patient and his team, make out who's the decision maker. And that comes with an eye which is keen. And you can then try and make a lot more eye contact with that person, explain things to them, but do not ever neglect the silent patient, because the lady may be very silent, but she'll go home and say, well, I did not have a good rapport with the doctor. I did not develop the faith in him. And then the procedure is out. So make sure you have a good eye contact with them, an honest talk, a heart-to-heart talk, develop that connection, which is the most important thing in any communication. That if you develop that trust, that communication, that link, that vital link, then everything works out. So definitely the attendant is important, but the silent patient also is important. So have an eye contact with all of them, all the important people, but make sure the patient also. And definitely, if your communication has been scientifically right and EQ has been right, emotional quotient, and your link with the patient has been right, it will work.
Dr. Mehta, you were saying about the attendant, you can express your thoughts more?
Yes, absolutely. I'm more than convinced that in that team, remember you attend a lecture when you were doing your undergrad, after your good lunch or dinner where you were least interested in attending a pathology lecture or a biochemistry lecture, and 80% of it just disappeared. So also in a consultation, by the time you talk about various lenses or various things to the patient, 80% of your stuff, what you said, is going to disappear. So remember, somebody is going to remember there. So your attendant, as I said, is the most important thing. You look and that's why the communication skill of a public speaker. Look at everybody. Identify who's the main person and showing empathy to the patient. The patient is generally wanting to depend on somebody to take decisions for them. कि ये सही है या ये गलत है. So your attendant is always quite well prepared. And always respect them and call them. Never underplay them. Never insult that they don't know anything and that you are smarter. Never, a lot of people have a tendency to put somebody down in a conversation, to say that I'm smarter than you. What do you know? I've spent 20 years in ophthalmology. What do you know? You'll not understand anything. Now that ego of that is something which you don't want to touch. And that is where that subtle talk, showing exactly what you know, but not overpowering them, and being very humble at the same time, with a big smile. Remember, smile, 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 smile. Dr. Swarup said in the beginning, everybody please smile. And I totally agree with you. Don't get stressed out. It's not your final MS exam. Even in MS exam, Dr. Grover being the examiner would have realized all those kids who smile more, you don't tend to ask more difficult questions to them.
Dr. Somashela Murthy, your closing thoughts on this, on your experience from the LVPI?
So I just want to sort of bring into perspective that it also depends on what surgery you're doing. For example, if it's cataract surgery or refractive surgery, yes, you have to inform the attender and make sure they understand. But the attender is very important. That I agree with everybody. But it depends on the kind of, say, if you're doing a corneal transplant where you definitely need the patient to have a lot of buy-in because there's going to be a lot of follow-up, or if you're treating uveitis that I treat, and the patient also has to understand. So for me, it's almost equal kind of attention split. make sure that the patient understands everything. It doesn't matter if they're uneducated or they're not the earning member of the family or they're not the decision maker. Like it could be the elderly mother, the non-seeing patient. So I explain it to them in the way that they can understand. And then the other details, especially the finances and what is involved from the attender's job responsibility point of view. So that the attender has to understand, because they have to bring the patient for follow-up and they have to understand that it's uveitis, they need treatment and so on. So for me, both are equally important. And exactly as Dr. Mehta said that, don't belittle anyone. And of course, I'm sure that nobody will do that. But sometimes so unfortunately in India, it's a cultural thing. So you won't have just one attender. So you'll have the whole family. Sometimes I think Rishi, somebody mentioned that, say it's a very serious disease, a grave condition, like say a bad injury or something. So then, there are a lot of family members who have come in. So sometimes typically I say, okay, everybody get into the room. And so because they're all very closely involved with what's happening to the patient. And sometimes you just give a joint kind of information to everybody. Yeah, it's very difficult to take everybody's questions together. But otherwise, you finish with the attender, you go out, the other person comes in and says that is my uncle, what do you think? Then somebody else comes in, that is my so-and-so, what do you think? And so sometimes it's better to just do a joint, like a family consultation. I just wanted to mention that this is part of informed consent also. And in certain hospitals in very severe diseases, we may have that. Some of us may become ocular oncologists and so on. The whole family, whoever's there, is brought into the room, and then the explanation that the doctor gives is actually recorded. So more and more, when you guys become our guys' age, not Rishi, but maybe the rest of us, so there may be some very legal documentation that may be required. So I think it's good to have the whole family on board.